In 2015, 15,000 Americans died from opioid overdoses, and since 2006, the number of opioid prescriptions has been increasing. Liberal prescribing of narcotic pain medication is one of the main causes of opioid addiction. In fact, in a 2014 survey of members of the American Medical Association, 85% of the physicians surveyed felt that prescription drugs were being overused in clinical practice.
In 2006, the Centers for Medicare and Medicaid Services, CMS, and the Department of Health and Human Services created the Hospital Consumer Assessment of Healthcare Providers and Systems, otherwise known as HCAHPS survey, which was initially designed to measure the patient's quality of care received. When the Affordable Care Act became law in 2010, the HCAHPS survey was mandated as the pay-for-performance model for reimbursements from CMS. The higher the hospital's patient satisfaction scores, the higher the reimbursements. Of the questions related to the patient's perceived experience, 3 pertain specifically to pain and pain management.
Interestingly, increases in opioid prescriptions, misuse, and overdoses began to increase not long after the HCAHPS survey and pay-for-performance model was enacted. While meant to increase patient care and lower costs, the new model resulted in unintended consequences in the area of pain management. The PROP Act of 2016 was introduced to negate these consequences. Pain management should not be a method for determining quality of care and reimbursement. Linking pain with financial gain has led doctors to feel pressured to overprescribe opioid medications. It has helped foster this opioid epidemic. The PROP Act of 2016 proposes that the questions pertaining to pain management be removed from the HCAHPS survey and from consideration by CMS in determining performance incentives. Severing the ties between pain control and payments will help relieve the pressure doctors are under to prescribe the opioid narcotics, which can so easily lead to death or addiction. Doctors, not the federal government, know how to best treat their patients. Hi, I'm Jen.
Hi, I'm Laura Jones, and we are going to talk to you a little bit more about the PROP Act of 2016. And I apologize for the picture screen where we're talking. It's with how our graphics are, it doesn't line up right, so I know you can't see us that clearly in some of these slides, but maybe that's for the best. So I'll let Jen talk to you a little bit more about this.
So the PROP Act of 2016, S.2758, is Promoting Responsible Opioid Prescribing Act of 2016. It was intended to amend Title 18 of the Social Security Act to remove consideration of certain pain-related issues from calculations under Medicare Hospital Value-Based Purchasing Program. It was introduced as a companion bill to H.R. 4499, which was also called the PROP Act of 2016. That was introduced in the House, and they were both for the same purpose. And there was also another related earlier bill called CARA, Senate Bill 524, which is the Comprehensive Addiction and Recovery Act of 2016. And CARA was basically designed to assist the government in the fight against drugs in the United States and basically gave them the freedom to do what they needed to do to fight this war, long story short. And Ron Johnson, when he introduced this bill, kind of did it as a piggyback of CARA or an amendment in order to just kind of have more steps in the process of the fight. So Prop Act of 2016 was introduced to the Senate on April 7th of 2016 by Senator Ron Johnson, who is from Wisconsin. And it got transferred over to the Committee of Finance and then kind of sat there for a while until the Department of Health and Human Services, I guess, feeling pressure that the bill was going to actually pass or alleged just kind of controversy going on politically, they decided to come out in favor of the bill and actually, I don't know how it actually happened, but remove it from vote and basically announced that the changes proposed in it would become regulation under their jurisdiction. So while the bill never got voted on, never made it out of the 114th Congress, the main purposes of which it was designed went into play. So I guess in theory, it was adopted and it won.
So the Prop Act of 2016, the issue is centered around the Centers for Medicare and Medicaid Services, CMS. Those questions on the HCAHPS survey that pertain to patients' perception of their pain management while they're in the hospital. So that is the real controversial issue. So under this value-based purchasing program, the amount of reimbursement or incentives from Medicare is tied to these HCAHPS scores. So the proponents and supporters of this bill don't feel that that's right, that a patient's perception of pain is linked to financial reimbursement. So what's happened is providers have gotten more aggressive with pain management and a lot of times are maybe prescribing unnecessary opioids or overprescribing them just to try to keep the patient happy and make sure they get good scores on these surveys when really that may not be the best thing for the patient. So again, the goal of this act was to get these questions from the HCAHPS surveys removed. And as we had mentioned in the previous slide, that is ultimately what CMS ended up doing.
So as I currently mentioned, there is obviously a drug epidemic going on in the United States right now. From 1999 until 2004, drug overdose deaths have nearly tripled. In 2015 alone, there were over 52,000 drug overdose deaths and 33,000 were from opioid overdoses. Sales have also increased or quadrupled with over 183,000 deaths since 1999. So the numbers are really staggering. In 2012, more than 255 million Americans had an opioid prescription, and that equated to a prescribing rate that year of 81.3 prescriptions per 100 people. That is a lot of drugs being out there. Being prescribed, and maybe not always necessarily. And the drugs most often that they're seeing are methadone, oxycodone, like OxyContin, hydrocodone, Vicodin, and it's staggering. And it's normally younger people, ages 25 to 54.
So in relation to Prop Act 2016, since it is about pain control and patients' perception of pain, we thought it'd be important to give a little explanation about pain, the fifth vital sign. We've all heard that term, I'm sure many times, and just give you a little history of where that started and kind of what it's caused since it's been initiated. So the American Pain Society created Pain, the Fifth Vital Sign campaign. And what happened was people became more aware of pain, and that led to providers being more aggressive with their approach to pain management. In 1998, the Federation of State Medical Boards reassured physicians it was okay to prescribe notable amounts of opioids. We're not quite sure what notable is, but obviously it's more than they were prescribing. And then the DEA also adopted this position. So what happened? Opioid prescribing increased. And then, as we talked about related to this act, Prop Act 2016, in 2010, the value-based purchasing program was established as a result of the Affordable Care Act. The goal was to reward hospitals for quality care, which is a great idea, but you can't have patients' perception of pain scores linked to quality of care necessarily because pain is so subjective. So patient pain scores are now or were part of the HCAHPS scores and linked to financial reimbursement. Luckily, as we mentioned before, those have been removed from the survey.
So there were several official supporters of the Prop Act. Here in Wisconsin, Attorney General Brad Schimmel, Senator Ron Johnson was the one that introduced the bill, and you can see there like the original co-sponsors, the American Medical Association, the College of Emergency Department Physicians. We feel that physicians who are feeling pressured to overprescribe were also in favor of the Prop Act. Patients who are wishing to have help with recovery, or people who have seen their friends and family suffering from misuse of opioids, are all supporters. Nurses ourselves, who feel pressured to constantly be talking about pain and giving people pain medications when they're not obviously maybe in pain. And then the original proponent or opponents were like CMS, the Joint Commission, the original people that designed the new surveys. And I can imagine that pharmaceutical companies aren't going to like to see um, pain not being such a focus because obviously it's going to affect the number of prescriptions and then obviously a loss of revenue. And drug seekers aren't going to like the new regulation. And
All right, so the recommendations based on the Prop Act 2016, first and foremost, we need to make healthcare facilities aware that the pain scores are no longer on the HCAHPS survey. I don't think many people probably know this is even going on, and it just recently was changed in October of 2017, and they should see that on the new surveys after the first of the year. So hospitals just need to do a good job of making the staff aware and also just educating nurses and providers about alternatives to opioids and different modalities of pain management. And as I just said, providers also need to kind of change their practices and use a tiered approach to prescribing pain medications. And also, pain management should be a collaborative effort with a multidisciplinary approach. We have a lot of people on different teams, throughout healthcare facilities. There's no reason that we can't utilize multiple disciplines and really take a multi-pronged approach to pain management. And lastly, the quantity of opioids prescribed should be smaller, especially for minor injuries. We see this a lot, say, for example, with somebody who has oral surgery and may get a prescription for 2 to 3 weeks worth of pain medication, when really they should only really be acutely be treating their pain probably for a couple days. So then what happens is those medications aren't destroyed properly. They're left in the cabinet and teenagers or whoever, other family members have access to those and it leads to misuse. So just really being careful about what the medications are being prescribed for and then trying to do smaller quantities with closer monitoring. So we hope that you learned a lot about the opioid epidemic and how much this bill or this act hopefully made some changes that are actually useful, even though it didn't get passed.
yeah, and it may, in theory sound kind of trite or minimal, but I mean, I think just removing that pressure to constantly be talking about pain in the setting is really going to help all these recommendations come into play more. That we shouldn't be getting paid by how patients feel their pain is being managed. So, good luck and enjoy the rest of the semester.